I recently saw a patient who had periodontal disease or gum disease that we have been attempting to get under control. And she was doing everything right. She came to see us every 3 months like she was supposed to. She was very compliant in her care with us, and she was very compliant with her care at home. But we were not seeing the periodontal disease or the gum disease stopping. And we talked to her about where her diabetes was at, because she also was a diabetic. And she told us that her doctor was not able to get her diabetes under control. Her sugar was up and up and up. And despite all these medications, they just could not get those numbers where they needed to be. And I talked to her about how gum disease and diabetes are connected. When you can't get gum disease under control, you can't get diabetes under control, and vice versa. And I also told her a story about a patient that we had a long time ago who was diabetic and who had really severely progressed gum disease. And by the time we saw him, he hadn't seen a dentist in a very long time, and there was really nothing that we could do. And so he was at a point where he needed to lose all of his teeth. And he did, and we gave him dentures. And when we gave him dentures and removed all of his teeth, his gum disease, his periodontal disease was gone. And all of a sudden, his diabetes, it was under control. His doctor no longer struggled to get his sugar where it needed to be. And that, I think, is the perfect display of how gum disease and periodontal disease, along with diabetes and the other systemic conditions, come hand in hand. Do not forget the fact that your mouth is part of the rest of your body. And so presented with that information, I think it empowered and encouraged the patient to take the next necessary steps to do what needed to be done inside her mouth. And so we empowered her to finally go see a specialist, a periodontist, and possibly put her in a place where she needed to face the possibility of removing all of her teeth. That was probably the next step for her. And she would need to do that in order to get her diabetes, in order to get her health, her entire body health under control. It's a scary and very, very, very difficult decision to make. But I believe that she is going to make that decision to make her overall health better.